please introduce yourself?
Hi, my name is Bere, and I am a nurse practitioner. I'm working in oncology.
Where are you from?
I'm originally from Boston, Massachusetts, and I moved here for undergraduate studies and got a nursing job here, and I've been here ever since.
What was your role model growing up?
I was fortunate enough to have a lot of different role models. My main role model was definitely my mother, and still is to this day. She was diagnosed with type 1 diabetes when she was 10. She's now 65. So she was an early type 1 diabetes diagnosis, and I really just have always admired the way she's taken care of herself, advocated for herself, respected her body, and done her best to keep herself as healthy as she can be. She also taught me a lot about what it's like to deal with a chronic illness and even the medicine behind it at a very young age. And so I think that a lot of her struggles and her ability to overcome them is largely why I started to focus in medicine originally.
What else motivates you?
I think that the best part about my job to me is being able to be a support person in a medical way to people undergoing one of the most probably challenging time of their lives. And so what motivates me is being able to be that support person, not just from an emotional standpoint, but from a medical standpoint, and being able to help their quality of life while hopefully treating their cancer in the process. So that knowledge that I'm helping in a few different ways to make their lives better while forwarding our goal in medicine, which is to cure cancer, is what keeps me going.
What is one thing you want people to know about you?
First and foremost, that I deeply care, not just about them, but about everything that they have going on, and that it all plays a role. So when I get to meet somebody, I don't just want to know their name or what their diagnosis, if it's a patient, or what their job is, but also like what their family life is like and that sort of thing. So when I like to get to know people, I like to get to know them comprehensively.
What type of patients do you normally see?
So in our clinic, we see all metastatic, terminally ill patients who are on a phase 1 or a phase 2 clinical trial. Or patients that have a rare cancer that isn't treated with, they don't have a lot of standard options. So they come to us out of necessity to be in an academic center where we can use experimental therapies and also think outside the box to treat the unique nature of their cancer. Or they have a common cancer that has progressed on multiple lines of therapy and they're looking for other options that aren't clinically approved yet.
What aspects of practicing medicine do you find the most challenging and rewarding?
The most challenging has changed dramatically in the last couple of years. I think the main issue that I have on a day-to-day basis is access to different specialties, access to medications, access to insurance company approvals. I think logistics have become insurmountably harder over the past 2 years. Particularly, I find myself facing a lot more denials for things that used to come easy, like CT scans. So if I want to order CT scans to touch base with a patient's cancer, that often gets denied. And then we have to appeal to the insurance company and get on the line with somebody from the insurance company and fight a case to have that CT scan, a very basic imaging test, approved. So the logistics of our job has gotten a lot harder. I think the pandemic has something to do with that as well, with the access, particularly in the state of the union with medical personnel, but also insurance, and the logistics of getting the job done have become more time consuming and frustrating. I think the best part about my job is the patients. I mean, we're seeing some incredible therapies that are working, and my coworkers are incredible. So my colleagues are great. We really learned how to band together, particularly during COVID, and so I think working with a strong team is everything.
Speaking of team, how do you collaborate with other healthcare professionals, such as physicians and nurses?
We have, I think, a huge thing that our group does on a regular basis is team meetings. So we sit down together with the physician, the APP, the advanced practice provider, and the nurse, and talk about each patient. I think it fosters community among the team, to be honest, because we all bring different things literally to the table. And we all provide different things for the patient. So we can kind of talk and see what each other is doing. That's the first best thing that we do together. I think proximity plays in our favor too. We all sit in a common workspace, kind of just talk about our day-to-day lives. We also try to have some outings, see each other outside of the office and just learn about each other's outside of work lives. And I think all of that really fosters that teamwork.
So in your opinion, what are some traits that make a good healthcare professional?
I think diligence is one. You have to be diligent, you have to be consistent, you have to be properly motivated. This job, you don't go into healthcare necessarily for the money. It takes a very unique person to balance the amount of intellectual demands, personal demands, and emotional demands, particularly in oncology. Those three things need to be present, and you need to be very driven professionally, but you also have to have an immense amount of compassion and empathy. And it's hard to keep those all in check and find people with a good balance of those things.
Mm-hmm. While we're on the topic of like work-life balance,
Yeah.
how do you relax after a long day of work, or do you have any hobbies that you like to do?
It's a good question. I think I'm fortunate enough to have two very young children and a husband who's not in medicine, and I come home and I'm quickly snapped out of whatever was going on during my day to take care of the needs of my family. Kids also bring a remarkably pure outlook on life, and I learn a lot from them. Frankly, some days it's that they need me. They need mom, and they need mom to not be at work. And so I switch gears quite easily. Exercise and talking through things with friends is always a good outlet for me. Talking things through with my colleagues is a great outlet too, because they're the only ones that really understand what's going on. My husband asks me about my day, but it gets really annoying or repetitive, I can imagine, for me to say, oh, well, another 40-year-old went home with hospice, and he tries, but my colleagues are the ones that understand what that meant for me and how heavy that is for me and how to help me through it, because they do it too. I also love baking. I don't like sweets, but I like baking sweets. So cupcakes are my current thing.
What is the greatest lesson you have learned from your overall medical experience?
If you ever get diagnosed with an illness, identify a fierce advocate for you. Hopefully your closest person in your life, but if that's not possible, find a friend who's going to stick with you from beginning through the disease, who's going to be able to show up, whether it's via telephone or in person. However, you need to find somebody to walk alongside of you and help you navigate everything that you're going to be facing. Not just cancer, this is anything. And the healthcare system is not perfect, and it's very overwhelming as a patient to have to do this yourself. And so my biggest piece of advice for patients is find your person, find your village, so to speak, and have someone present with you during the crucial times, during those appointments, because it's very difficult to navigate, particularly if you're not medical yourself. And so identify a point person, because no one's going to advocate for you like your friends or your family.
How do you build trust with patients in your care?
Time. I think it's, by the time they meet me, they've had a lot of different clinicians in their lives. And so they're on a clinical trial, they've been introduced to a clinical trial, all of that is new, but they're not new to being a patient. People know when you're there because you care or you're there because you have to be. And I think just showing them consistently that you're there because you care about them and that you will treat them to the best of your ability. I think honesty is also a huge thing. I'm not one to sugarcoat. I will always give it to you straight. And so I think that patients understanding that from me you will get a straight answer. It may not be the one you want, but it will be honest. And I will not mislead you in any way. And whatever I have to tell you, I'm going to be there. So I think reiterating that, because again, by the time they reach our clinic, they've been through a lot, and they've had people that have probably let them down in their personal life and in their care. Identifying yourself as one of those people that will not let them down and will not let them be alone, whatever that needs to look like for them.
Do you have any special tips or tricks when caring for the patients?
I think just being yourself, and again, being forthcoming, being honest about it. It doesn't have to be all doom and gloom. You maintain hope, but you are there to provide a service, which in my case is to help someone through to the end of their life. And so I think just coming alongside of them, being exactly who you are, and telling them honestly where they're at is the best way to do things, and also to provide consistency. I think telling stories about your life when applicable, I think is also a good way to kind of find some common ground. You know, if I have a patient with young children, we have more than enough to talk about you know, different things, or if we both have a dog, or, you know, just find those commonalities with patients. And don't make it all about you. Those things make you more relatable. I'm not just this white coat. I'm a person. And so I care about you. I'm also a person going through things. Let's work through it. Relatable is, I think, the biggest thing.
What is a challenge you feel healthcare professionals face today?
I think burnout's a huge one. I know numerous people by this point that have left medicine altogether. I think particularly nurses were pretty undervalued during the pandemic, and I think a lot of people were fed up and they didn't have to be here, they could go do other things, and so they did. So I think burnout, checking in with your colleagues is important because it's a huge challenge, and it remains a huge challenge. I think the way that without going on a tangent, I think the way that our healthcare system is set up in such a way that it's a for-profit, and so clinicians there's a lot of demands on clinicians in terms of volume, and that can equal not enough time to do the job as well as you want to. And I will tell you, to me, there's no feeling worse in the world than knowing I could have done my job better, but I didn't. You know, I wanted to do my job better, but there were certain constraints that wouldn't allow me to. And that's a pretty bad feeling. And so that's a major thing that I've heard from colleagues and why they're burnt out.
On a lighter note, what is one piece of advice you have for aspiring healthcare professionals?
Don't lose sight of why you want to do this. Your motivating factors, so to speak. Those will get you through. Do not do this for the money or the compensation. Do not do this for the notoriety. Do this because you have an interest in helping people, furthering medicine, and working with great colleagues. But do not do this, for the motives that we think won't get you through. It's about people and helping people and furthering medicine. As long as you clarify that, and that'll help.
That's beautiful. Thank you.
Yeah.